New Zealand's medical regulator has approved the Pfizer COVID vaccine for children aged 12 to 15. The jab is already approved for residents aged 16 and above. The move will allow 265,000 people in that age bracket to be vaccinated by year's end. New Zealand has 10 million doses of the Pfizer on order this year. For more, joining us live is Christopher Blyth, a paediatric infectious diseases physician at the Telethon Kids Institute. Appreciate your time. I do want to ask you about vaccinating children in a moment, but firstly, how are the COVID variants that the world is now experiencing, how are they affecting children? Is it still the case that even with these new strains, children aren't at a big risk of getting very sick and dying from COVID, or is that starting to change?
You're right. So children remain at lower risk of COVID compared to adults, and that's why the priority in Australia remains vaccinating adults. Yes, the variants will continue to change, and that will may change that, but actually at this stage, we're still seeing children at much lower risk of COVID disease compared to adults.
And does that count for long COVID as well? Are we seeing children experiencing any sort of long-term side effects after catching the virus?
Some children can get severe disease from COVID, and we've seen that before, both with the original strains but also with variants. Some of the longer-term manifestations in children are still emerging, but actually the take-home message is actually still children are vastly lower risk of severe complications from COVID compared to adults.
There was a lot of debate at the start of the pandemic about children as vectors of the virus. Some experts suggested children could be a form of super spreaders. Others said they weren't so big at spreading the virus. What do we know now? What's the latest in terms of children's ability to transmit the virus and how that factors into the debate that we see about schools opening during outbreaks?
Sure. Children can transmit the virus, but compared to others, particularly younger adults, appear to be less transmitting compared to others. But they can do, and so that's why it is important to consider this, particularly as far as a vaccine program. Particularly adolescents, I think, is where things are particularly important because they have, systems much similar to adults at this stage. Young children appear to be much lower risk of transmitting.
As I mentioned, New Zealand's medical regulator is granting this provisional approval at the moment for Pfizer vaccine to be given to 12 to 15-year-olds. Mm-hmm. It is a trend we're seeing, isn't it, around the world? No doubt here in Australia will follow at some point, but as you pointed out, it's really not the priority for us in this country just now. How much testing of the vaccines have we seen on children? What does the data tell us about how children react to the vaccine? Are there any risks that parents need to be aware of?
So you're right, a number of the international regulators, Canada, the US, now New Zealand, and many of the European regulators are looking at this very closely and has been approved for use in a number of countries, particularly for adolescents. We have good data on the use in adolescents as far as its safety and how well it tweaks the immune system. And so that really gives us some reassurance about use of these vaccines in children. But importantly, once we do start using vaccines in children, as is occurring particularly in North America at the moment, we need to watch this space very closely.
How far off do you think we are from seeing babies and younger children being able to get the vaccine?
So those studies are ongoing at the moment. I expect some of these data to be available in the second half of this year. Many of those studies, particularly with the Pfizer and the Moderna vaccines, are going down to children as young as 6 months. So I don't want to preempt what those studies will show at the moment. There are some challenges of doing studies in very young children because we need to not only look at the vaccines, but also what type of dose do we give children whose clearly body sizes are vastly different than adults.
Dr Blyth, we're in this position now, aren't we, where we're essentially seeing wealthy nations looking to vaccinate children, while in developing countries they don't have access to nearly enough of a vaccine supply for their adult population who are more at risk. Is that a debate that you'd like to see us have more rigorously?
We do need to make sure that we vaccinate the globe. Clearly, there are many countries susceptible to this, and we do need to consider how best to make sure that everyone can access vaccine at this stage. In Australia, our focus will remain on adults at this stage, even for the next couple of months, even ahead of any approval of vaccine use in children or adolescents.